Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, scarring is a natural part of the healing process after an injury. Its appearance and its treatment depend on the multiple factors. The depth and size of the wound or cut and the location of the injury matters a lot. Well, so to get our doubts clear, we are being joined today by Dr. Sudeepta Dutta, consultant cosmetologist from Swagat Hospital. So not to waste any more time, I'll straight away move to her and talk more on the topic which we have taken today. Well, thank you so much, Dr. Sudeepta, for joining to Good Life, the health show today. Well, today the topic which we have taken is a concern by each and every people. We are talking about scarring. Now, at first, I would like to ask you, what is scarring? What would be a general public know or general people know about scarring? Tell us.
Right. Good evening, Pooja. It's good to be back. We are talking about scarring today. Scars usually are an outcome of a healing process, which is a natural process. Whenever we get a cut or a nick, we can imagine our skin like a piece of cloth, and if we get say a piece of silk cloth, and any kind of injury to the silk cloth can be imagined by general people, what it does to the appearance of the piece of cloth. So the same happens to the skin. It might be a simple cut or a nick or a burn or an accident which might cause just a tear in the skin. That usually heals naturally, but then it leaves scars, right? So the scar is not much of a concern if it's a natural scar, if it's a normal looking scar, or are in hidden parts of the body, parts of the body which can be covered with cloths, covered up easily. So it usually is a concern when it is in the visible areas, say in your face, your arms, your hands, which are visible, and the scars don't look as good as they should, then it's a matter of concern. And that's when people suffer from a lot of psychological problems. They don't like to face people, they have confidence issues, they have a lot of issues with the scars. So that's when they can consult a doctor and think about the management, how to manage it, right?
All right. Now, doctor, there must be types of scars as well, and we will also come to that discussion that how does scarring happen. Now, if we talk about the types of scar, what would be that?
Right. Types of scar, as we say, if it's a normal one, it usually doesn't show up much. It's usually of the same color as the skin. It might be a hypertrophic scar, it might be a contracture scar, it might be a keloid, it might be a scar on the face left about by the acne or chicken pox or any other boils or injury to the face. So that's when it needs to be managed medically. So the normal scars are not usually much of a concern. They can be easily treated by over-the-counter medications. But most of the contracture scars need to be treated properly. You need to consult a surgeon or a skin doctor or a cosmetologist for it. The contracture scars need to be cut, and contracture usually restricts the movement in that particular part of the body. So we need to remove those contractures to heal the scar. And then after that, there are various modes of treatment for that. Besides that, keloid is one where the scar outgrows the injury area. So it starts looking very ugly. It might be a piece of, it looks like a piece of flesh on that particular area, and it might not be too much of a it doesn't look good on that on the particular areas, affected areas. Besides that, there are hypertrophic scars. Hypertrophic scars usually don't outgrow the site of injury. They usually occur in the line of the injury, but then they are red, they are swollen. So that's when the doctors need to come and treat. So, and besides that, acne scars, yes, of course, they cause a lot of confidence problems in the patients. So that's when we need to treat it with various methods. You need to consult a doctor for it, right?
All right. Now, if you tell that if we want to know about that, how does this scarring happen? And of course, there is an issue of confidence which becomes low if you have a scarring. And viewers, the numbers are flashed on your television screens. If you have any queries regarding the topic we are discussing at this point in time, please call up and ask your questions. Dr. Sudeepta Dutta is with us. At this point in time, she will be able to give you all the answer. Now, doctor, coming back to you again, now, how does this scarring happen? Now, if it is a minor scar, if it is a major scar, how does it happen?
It usually, as I said, it's a normal natural process. It's a process of healing. The cut that has happened in your skin or the deeper tissues, they usually get repaired by the body itself. The body helps it because it's an injury. The body starts working on the injury area and starts rebuilding those areas to form a scar tissue. That is like
doctor,
hardened tissue, which usually is a outcome of cut. Yes.
Okay, doctor, we'll come to that discussion, but we have a caller at this point in time. Let's take the call. Hello.
Yeah, hello. More for the তাক যোৱা বছৰ আগষ্ট মাহত গৰম পানীয়ে পৰিছে বুকুত মানে অলপ এনেকে হেৰি হৈ গৈছে ডাক্তৰ হৈ গৈছে এতিয়ালৈকে ডাক্তৰ ক্লিয়াৰলি যোৱা নাই তাৰ কাৰণে কিবা মেডিচিন ইউজ কৰিব লাগিব নে এইটো নিজে নিজে গুচি যাব বয়স 6 বছৰ ল'ৰা
All right. All right. If you can hear, doctor, there was a concerned viewer at this point in time, and she was asking about her 6-year-old son. So she's concerned really about the scar which is been at this point in time. Now, she's asking a question on his son. So could you please, if you can hear me, could you please reply her?
Right. So that's what the thing is that we need to see the patient to identify the type of the scar. And then we need to decide the mode of treatment. Usually, over-the-counter medications are available. There are many medications containing heparin. There are medications containing allantoin. There are medications containing silicone. So silicone patches are a lot of help.
Silicone.
So
those silicone patches are a lot of help. So we have to decide it after we examine the scar. And then and usually at 6 years of age, we don't usually advise treatment sessions or clinic sessions.
All right.
Over-the-counter medications are what we would like to start with, and then decide whether it needs to be treated with any treatment sessions or clinic sessions. Right.
With that, we have to slip into a short break, but do come back soon because we have lots more on the other side. All right. Now, doctor, if we quickly want to know about the possible treatments of scar, what will be that? What is the first thing, if any of the patient comes to you, what is the first thing you do?
The first thing that we do is we examine the scar properly. We take the proper history of the patient, what had caused the scar. It might be an accident, it might be a burn, it might be acid, or it might be anything, a chemical injury, it might be an accidental injury, it might be a cut, it might be scars left behind by acne or some boils or any kind of eruptions on the skin. So that's how we decide what to do with the scars. Usually we advise home care with some over-the-counter medications which can be bought from the pharmacies. Like as I said, silicone patches are of great help. We can also go for allantoin and heparin containing formulations. Besides that, there is microneedling treatment. We do dermabrasion. These are clinic sessions for which the patient needs to come down to the clinic, say every 15 days or in a month. Say 15 to 21 days is the space between two sessions, and the patient might require 6 to 8 sessions depending on the type of scar. The age of the scar also is a matter of concern. So all these factors govern how many sessions the patient might need. And as I said, the home care is also advised. So the patient can get treated in about 3 to 4 months. And
right.
sometimes it might take longer depending upon the age of the scar.
All right, depending on
Right.
the age of the scar, depending on the things.
Right.
These are the treatment procedure, but it has to be examined, it has to be diagnosed first, and then things can be forwarded. Now, doctor, if we talk about the sessions which are usually necessary and usually required for the treatment, so how many sessions depends on the scar, which you are saying?
Right. As I said, the age of the scar also governs how many sessions will be needed. Besides that, the cause of the injury is also taken into consideration.
Okay.
And also how deep the scars are, that also matters a lot.
Okay.
Some scars might not be treated by the, as I said, the medications, the general medications that we prescribe. It might need clinic sessions also. So, as I said, some scars need to be treated more extensively, more aggressively. We might need to go to a cosmetic surgeon also. A plastic surgery might also need to be taken into consideration. And besides that, there are other radiofrequency treatments are also available. Microneedling, as I said, is another method. Dermabrasion is another method. And as I said, these are the methods that are available. And of course, we might need to get in touch with other departments as plastic surgery also.
All right, so this is actually very important. Now, talking about the session, we can't say exactly how much a session would be needed for a patient unless and until the patient is being examined properly. What is the intensity of the scar? That is very much important to see it. Now, doctor, not talking about some usually prefer medicines first, rather going for some laser treatment or some these kind of treatments. So, if we talk about the medicines, how medicines are effective for these kind of scars, what do you have to suggest?
Usually, as I said, the medications are effective when the scars are not too old or not too deep. So, we usually have to check the scars, the type of scar that is there. The age of the scar, as I said, is a major factor, and also like how deep the scar is, how bad the scar has occurred. That all these things need to be taken into consideration before deciding whether only medications are going to work or clinic sessions are also required.
All right, absolutely. Now, these are some of the basic ideas which, of course, a cosmetologist can give you if you have any kind of scar. Do not worry, do not lose your confidence, because cosmetologists like Sudeepta Dutta are there to help you out, to give you suggestions, and you don't have to feel low for that, isn't it, doctor?
Right, very true. As I said, there are solutions for everything, even a keloid. As I said, we get a lot of patients who have confidence issues. Confidence is one thing which is greatly affected by hypertrophic and keloid scars. So, there are several methods. There are monthly injections that they can go for to, silicone patches they can go for to suppress the look of the scar, and they can definitely lead a better life with their scars.
All right. Now, doctor, what suggestions you would like to give to our viewers who are watching our show? Because if they lose their confidence, that will actually hamper in their personal and also professional life if they are a working person. So, what do you have to tell them, and what do you have to tell that if you have any kind of scar, do not lose hope. You can come up to cosmetologist and visit them and know your solution, isn't it?
True, true. I'd like to tell everyone, whoever is suffering from scars, acne scars, your face is having acne scars, you're suffering from confidence issues, you might be losing your sleep over it, please don't do that. Come and see your doctor, get it checked and get a proper solution for it. Scars are very much treatable. I won't say that it will be 100% all right, but then 70 to 80% can be done to your scars to make it look better. You can lead a much better life with treated scars. Yes.
All right, all right. Thank you so much, Sudeepta Dutta. Swagat.